Welcome and thank you so much for so many of you coming. I'm going to start with a brief overview of Findacure's work and what we're really trying to achieve before we start on the main presentations. And so just a reminder, like I said before, the Wi-Fi password and username are there, and the sort of official hashtag, if anyone wants to live tweet, is #ECFunding. So we're quite a new charity at Findacure. We were set up out of our founder, Nick Soro, his experience setting up a patient group. And he realized that there's a real need for more hands-on practical advice for small rare disease patient groups, that there's not a lot of information about how to do the everyday, the managing, setting up consortia, getting involved with research. So that's what we're trying to provide, is the guidance and advice on how to really get started and get involved and best support patients. So the three main areas that we're focusing on is empowering patient groups, facilitating the development of research, and campaigning for a receptive research environment. So I'm going to go into what all of those mean in a second. I just want to explain what this term fundamental diseases are. So we've come up with this new term to overcome the sort of apathy that people face when they hear the word rare diseases, that they hear the word rare and assume it doesn't affect anyone and why should they care? And what we're trying to emphasize is that rare diseases are actually not just important in their own right, but they're also fundamental to our understanding of more common conditions and human biology as a whole. And so we like to use this term fundamental diseases, so extreme and rare genetic disorders that offer a unique opportunity to better understand other diseases, including many common conditions, to emphasize this fundamental importance. So we use a couple of examples to emphasize this. So, for example, familial hypercholesterolemia, the study of this very rare condition led to a better understanding of the mechanisms of cholesterol, which led to the development of statins, which is a drug that is very widely used to help with high cholesterol. Some other examples we have are alkaptonuria, which we'll be hearing about later, which is actually a very accelerated form of osteoarthritis. And research into alkaptonuria is actually revealing some interesting things about bone structure in osteoarthritis patients. And so what we're trying to do at Findacure, one of the key aspects is to empower patients. So these are workshops like today. We try to really cover key issues that there might be a lot of information on the internet, but it's very widespread, and we try to condense it into workshops like today. So we actually ran our first workshop back in January that was just on general how to access funding for organization management and the everyday, getting salaries, doing patient support, and all the slides of that are on our website if you're interested in seeing it. And so we will be running another 2 workshops this year. So if you're interested, we will be having a feedback session afterwards where we can find out what topics you'd like the next workshops to be on. We also work with patients and help them drive research into their diseases. So we're currently working on 3 main projects. So we're working with an EU consortia on skeletal diseases. We're working to drive research into ataxia, and we're also working with several patient groups to develop a gene therapy for Duchenne muscular dystrophy. Next to this, we're also working with a few research teams, university research teams, who are looking to develop a treatment for hemophilia and factor VII deficiency. And beyond this, we're also trying to engage the public and scientific community around the importance of rare diseases and studying rare diseases. So we held a scientific workshop back in March that was attended by 36 different people from 4 universities, 9 research teams, 3 pharmaceutical reps, 4 biotechs, and 9 medical charities to try and gain an acceptance of this term fundamental diseases and really drive research. And on the term of engaging the public, we are currently doing a crowdfunding campaign that's trying to raise awareness of everyday lives of people with rare diseases and trying to stress the importance of this term, fundamental diseases. So we've got this aim to raise $25,000, and that would all go towards running more workshops like this and building an online toolkit that will have practical advice that will just be free on the internet for anyone to access. So we just actually hit 25% of our target today, which we're very happy about. And we just really appreciate if you could share that with your networks so that we can keep doing workshops like this. And so I'd just like to finish on a quote that's very much at the heart of what Findacure is all about. And what we're trying to stress is that we should treasure our exceptions, we should treasure rare diseases and work as hard as we can to support rare disease patients. So thank you for listening.